Hey guys, welcome to the Living.Fit Show. This is your host, Jesse Grund, and I'm here today with Dr. Andreo Spina, the creator of Functional Range Systems, FRC. If you don't know about it, you need to, and that's what part of our conversation today is going to be about how it is revolutionizing how we train, how we look at biology, and how we improve individual mobility and individual strength. Dr. Spina, thank you for being with me today.
Thank you for having me on, my friend. It's good to see you.
It's good to see you as well. I haven't seen you since the ISM in Pittsburgh, which was...
Oh, yeah, at U of Pitt.
Yeah, that was, I think, just the second ISM that you guys had done. It was probably my favorite course that I've taken so far, to be honest with you.
Well, that's surprising because if you recall, we had to compete with there was a women's volleyball game going on in the gym beside us for about an hour and a half, eh? So I think I screamed the introduction. We were all huddling together. Remember that?
Yeah, not even a little distracting having girls volleyball going on at the same time.
Yeah, right.
A little bit.
It's a good thing there was a divider there.
Right. Yeah, exactly. So FRS as it stands, there's a number of certifications under FRS. We have FRC, we have FRA, we have FR for our hands-on practitioners. We have Kinstretch and we have ISM. Tell me how your background, where you were from an education perspective, led you to creating functional range systems. What felt like there was a need that was not being met inside the training and education community?
Well, it's funny because all of those components happened at different times. And I always tell my guys, if I could go back and reorganize it, I would have maybe put it in a more logical progression, because none of these things were my goal when I was in chiropractic school. Like, I didn't know it was my goal to teach courses. I was not a presenter by any means up until those points. But in chiro school, I took a real liking to anatomy, especially the cadaveric dissection. And I don't know if it was because of the anatomy professor that I had, or maybe just the way I started to see it, but I realized that the way that we were learning anatomy ultimately probably wouldn't be that helpful for a hands-on manual practitioner, right? If you were thinking about, there's one thing to have knowledge, and then there's another thing to utilize that knowledge when there's a living person in front of you. And I always noticed that the way that we learned anatomy was really to learn cadaveric anatomy. So, we learned two-dimensional pictures of anatomy. We look at these pictures in textbooks, and then we would go down to the cadaver lab, and it was almost like, if you want to see the subscapularis in the armpit, you have to get through, you have to remove a whole bunch of connective tissue and fascia. And at one point I felt like I was almost like an artist with the scalpel. And I was trying to create these images that people wanted to see. And I always put it back to that. Now, having said that, I had an anatomy professor who was profoundly influential on the way I thought. His name was Peter Cowenbergs. And if you can picture him, he was a silver-haired man, a little bit of a happy gut, but he would come in with a blue jacket on down to his knees, all covered in chalk. And then he would have two big bulges of chalk in his pockets. And there would be a blackboard, if anybody in the audience remembers what blackboards are. And he would just start to draw the anatomy. Like, he would just take out his things, and he would have it color coded. And I think the way he did it was in such a way that if you're going to draw something, the relative anatomy becomes important. Like this with regards to this. And he was a stickler that if we were going to follow a cranial nerve, he would take us right through all the foramens in the skull, and he would represent that by opening these dissections up on the board, and he would just draw them. So I think I took a particular liking to understanding relative tissue anatomy. And the reason why I felt that was so important is because when you have a living person in front of you, you can't just put your hand somewhere and then look at a two-dimensional picture and go, yeah, I'm roughly here. I wanted to know exactly where I was. So I started to learn or to merge anatomy class with another class that we had, which was chiropractic technique, where you would learn palpation, however minimal it was. And, I don't want to shit on the chiropractic curriculum, because, I've spoken to thousands of physiotherapists and manual medical doctors and massage therapists, and it's always the same problem. There was a lack in palpation as a generic topic. So the first thing I did, I became a cadaver lab tutor at the end of my third year, which wasn't, I don't think it ever happened before. So I had a lot of experience in the cadaver lab, and I started teaching the students coming through with a relative anatomy concept. And then it dawned on me that this is probably something that, people would also benefit from if I was having these worries about working with live tissue. So I compiled through hours and hours of work at the cadaver lab, like after hours. It was me and another one of my professors for just hours on end. It wasn't a very social environment. I don't think you'd call me the party king of chiropractic school at that time, but I started teaching palpation. So I first started teaching functional palpation. And as soon as I put the word out that this course was taught, it was immediately sold out. So there was clearly a need for it. So that's how it started. So I started teaching palpation at my chiropractic school, and then that kind of went out into the ether, and I started getting, can you come and teach here and here and here? And that started the whole thing. So from there, it was just a matter of looking at the deficit I saw was that there was no systematic way to do things, right? So I didn't see that systematic approach to palpation. But then when I'm teaching palpation, of course, the natural question is, well, after you palpate it, like, how do you look at treatment, right? And I was being asked this by people who have been in practice for years, right? How do you observe treatment? So I said, you know what, maybe it's time that someone went into the literature and not to spit out what's been said. We know what was said. I didn't invent any literature. I always tell people I haven't invented anything. I just take things and I take a slightly different perspective of it, and then it often creates a whole new reality. So if I went into the literature and I said, what does the literature tell me about the application of force, which is manual therapy, and about how those forces are accepted by the body? And then the functional range release course just created itself, right? In manual therapy school, if people in the audience are manual therapists, that you're taught what the person before you did. It's the same with training, which I'm sure we'll get into later. Like, you're just have to be under the assumption that whatever came before you was somehow right just because of the fact that it was before you. Right. And as I went deeper into the literature and I went into different avenues that might not have been explored, like, there's one thing when you read like physical therapy literature. It's another thing when you go deep into like plastic surgeons and how do they look at it, and manual biophysics and how is that looked at, and microbiology and how is that looked at. So when I compiled it, it gave me this picture as to how the body accepts force inputs, which is really the language that we speak to cells in order to create change. And then, rules start to come out of that. Like, in order for a cell to care about a signal, it has to be applied for this long, right? And then I look at what's traditionally been done, and I'm like, well, why is the forces being put into the body not even come close to the numbers that we know from cellular research as to how long force needs to be applied? It just didn't make any sense, right? And then in manual therapy, as it is today, there's these magical things that are not real, like when someone feels your back and they're like, oh, there's a knot here. I remember thinking to myself as a student, like, saying there's a knot there is cute to say to your patient, because it doesn't really matter. At least at that point, it didn't. What was actually, you just say, oh, there's a knot, or this muscle's tight, or this muscle has an adhesion. But really, when you hold that against the literature, none of that makes any sense. Clearly, there's no knots. Adhesions are just, connective tissue that's laid down slightly haphazardly. There's more to scar tissue. I don't want someone on here to pick at my, we're not going that deep into the cellular, but as an analogy, it's that, collagen is in the wrong direction. How can you feel that? It's impossible to feel that. How can you feel, a piece of collagen that's misplaced? Or how do you get through the subcutaneous layers of fat and differentiate those bulbous subcutaneous fat pockets for knots? How is this done? And what does the literature tell us to do? So that was FR, functional range release. So I started teaching that. And then that parlayed into, well, if that's how you treat it, if that's how you palpate it and that's how you train it, how do you rehab it? How do you train it? And I had to do the same thing again. So I said, okay, well, I've been doing martial arts since I can remember remembering. So I've studied with a lot of different instructors who had different vantage points of training. And of course, I studied kinesiology. So I was privy to learn a lot of different ways to look at training. And if I went into the training literature for mobility specifically, what I started to realize is that it's not that we have a paucity of literature and a paucity of research. What we lack is people consuming all of that research and then taking a bird's eye view of it in order to try to make a systematic approach to how you deal with people. And that's what functional range conditioning is. The functional range conditioning is generally the concept that when someone comes to you to train or to increase mobility, it's not enough to say that you want mobility, for example. Mobility is not a thing that you have or you acquire. It's not like you say, oh yeah, well, I've been working on and now I have it. I mean, when I see on Instagram, somebody goes, what are the 3 best mobility exercises for the hip? That's not even the correct language for me. I don't even know what you're talking about, because you take a hip, which is a 3-dimensional construct of a ball and socket joint, and then you say, I want more mobility. It's like, well, where do you want the mobility? Do you want the hip to be able to dissociate forward? Do you want it to dissociate backwards? Do you want it to go superiorly? Do you want it to go inferiorly? Is there a combination that's needed? And that's what mobility is. It's specifically saying, I need to teach my body the ability to move into this particular space. And then the question is, do you have the space? And then the next question is, does your neurology understand the space? That would be someone at my door and my dog going crazy, but we could ignore that. So that was pretty much FRC. So it's the idea of taking a human being and breaking them down by way of their prerequisites to try to understand which direction they do have and which direction they don't have. And then it was always weird to me with regards to training, because as I told you, I did a lot of training, that nobody ever asked me, where does my hip not go? You know what I'm saying? Like, you go to a trainer and they're like, well, today we're doing snatches for time. And I was like, well, why am I doing snatches for time? Well, because you want to develop power. And then I would say, well, I don't execute power in the particular way that you're executing power in. So can't I train power in a different way than the particular movement pattern that you're forcing me to do? And now I'm getting further on down the line, but it all started with FRC and this idea that if my joints can't do what you're asking me to do in this particular pattern, then clearly when my joint gets to the limit of what it can do, it's going to call upon other joints. And that's called compensation. And this is what mobility training is. It's the idea of understanding, what can you do? What do you need to do? And then asking the questions, can you do it? And the answers that I saw for this topic were incorrect generally. For example, people would incorrectly use flexibility and mobility as a synonym, right? Like, because I can do the splits passively, that's supposed to somehow allow me to actively throw a head kick. I usually go back to martial arts examples because I've been teaching for years. And that's not the case. And what happens is, you're a martial artist, you want to throw head kicks, so you spend all this time passively getting into 180 degrees, but you only actively maybe train 80 degrees or 90 at the maximum of that 180. So that means we have another 90 degrees for which your nervous system doesn't understand, right? It's never been there before. How would it? It doesn't have experience there. It does passively, but one of the things that I always say is that, active training gives you active results and passive training gives you passive results. So if you're acquiring a range of motion passively without teaching the nervous system about it, what to do with it, how to execute force there, you're not done. You've only done half of the equation of the generation of mobility. So FRC started to really look at, what are we spending our time doing? Like, how many sets of Romanian, Bulgarian, Turkish get-ups do I need to do for my hip to be healthy? And the answer is that that has nothing to do with your hip, right? These named exercises have to do with a predetermined movement path that I want you to be on, irrelevant as to whether or not your body wants to be there or knows how to be there. So that was FRC. And then, as you know, you can see how this kind of goes. Kinstretch comes out of FRC saying that, you know, I happen to believe that if you don't have a body practice, then you probably don't have control over your body. So yoga is a body practice, Pilates are a body practice. If I looked into those literature-wise, I don't want people to start hating on me saying that Dr. Spina hates yoga. I love yoga. I have thousands of yoga practitioners that run my systems all over the world. So I'm not saying I hate it, but what I am saying is you don't look like a downward dog when you're doing it. Like, that's just a word noise that people say. Like, I want you to do the flying pigeon and the spreading dragon. It's all good, but those things are displays of what your mobility can do, right? Like a mobility flow that someone does in the morning. You know, I'm not saying it's not good for you. I'm not saying don't do it, but understand that mobility flows are not the training of the quality of mobility. They're just the demonstration of what your body can do over and over and over again, which is great if you want to maintain what your body can do, but it does nothing to push the envelope of that particular quality. And then the internal strength model, exactly the same thing. If you take all of the literature on strength training, which, by the way, I didn't invent, nor did I change. I read the exact same journals everyone else does. But if you look at what the literature says and you look at what people do, there's this obvious problem where what people are doing is for the sports that created those exercises as opposed to for them, right? So that's why in ISM, we go through the history of strength training and we start to explain that many of the mouth noises that we use to describe exercises, squats, deadlifts, bench press, these are exercises that were broken down from other exercises which were the goal of those athletes, right? If you take what a strength athlete does, right? There are sports where the goal is the display of strength. And what happened was those sports started dictating how all other sports trained, right? I need to be powerful. I'm a soccer player. So what do? Oh, you go to a power lifter. Why? Because it says power in the title. But being a good power lifter never made anyone a good soccer player. Just like being a good soccer player never made anyone a good power lifter. Again, people are going to say, well, that's, there's generic crossover. 100% there is. But that's another problem, is that training is extraordinarily generic. And I think that training should be as detailed and as specific as a surgeon who is, performing surgery. And until you do that, you have no idea the power of your training inputs until you take that mentality of being as specific as a surgeon. That was a long answer.
No, but I mean,
remember.
I remember going to FRC back in I think I went in 2018 or 2019. You did it in Fort Lauderdale. And I remember you making the yoga point. And you just said, if I grabbed the people who created yoga and I brought them to today and I showed them the science, do you think that they would still want to practice it the same way that they did that?
I don't think so. If anyone's paying attention, right? If anyone really wants the answer, when new literature comes to fruition, that literature is immediately brought into your systematic view, right? Whereas most people just kind of shield that literature off to the side because it's not, it doesn't specifically speak to their narrative.
Yeah, specifically. Now, how did dynamic systems theory work into the way that you thought about how, because obviously I think the big difference, if we look at, I'm just going to use an example. If we look at the difference between FRC and FMS, for instance.
We didn't talk about FRA, by the way, but anyway, we'll get back to it.
Well, that's because we need to establish a point A, right?
Okay, good point.
I listen. Actually, I really wish I would have done my FRA in person, to be honest with you. I did a virtual FRA right before I did ISM, but it was still great. And I've probably done like 40 or 50 FRAs at this point. So, and it gets better every time I do it. So thankful for that. But if we look at dynamic systems theory, I feel like that's the big difference
Yeah.
in the way that FRC and functional range systems approaches training human biology. I think that's the major difference between what FRS does and what pretty much everybody else does, because the idea of dynamic systems theory dictating how we create movement, because I feel like in other systems we tend to see movement as this, oh, you've got your programmed movements in your brain, your squat, your hinge, your lunge, your push, and your pull, as opposed to dynamic systems theory, which says, hey, your body's going to look at, brain's going to look at the environment externally, internally, and then just take what it has and allow it to move. When did you discover dynamic systems theory? Was that early on? And did it drive a lot of how you determined how movement actually occurs?
I think that's very astute observation. That's if someone were to ask specifically, get to the point of the difference, that concept of dynamic systems theory, as well as the new literature on chaos theory, on emergence, which now, if you've been paying attention, that this concept of emergence has been blanketing almost every scientific discipline. And maybe we'll get into that. But dynamic systems theory, it wasn't new by any means when I started to become a focus of my study, but it started to become very, what's the word? Not fashionable, but people started to realize that somewhere when I was in chiropractic school or shortly thereafter, that's the way that movement is now understood. So for people who don't know what dynamic systems theory is, like you said, most people have this weird assumption that's not weird. I shouldn't say it's weird, because it was grounded in the science of the day, which was, motor program kind of theory, where there was this idea that you have specific base movements or primal movements, some people want to call them, somehow stored in the brain, ready to be executed. And that the purpose of training was to support those movement skills that were given to you at birth. And that's not how, if you were at if you're learning motor learning now, this is not the words that people are using. We now understand that it's far more complicated than that, in that movements, if you do a particular movement, let's say, I give this example, maybe this is a good time to bring it up. If you take a golfer and you strap up all of their muscles to electrodes and you get them to swing their golf club. Now, this golfer is a very good golfer. They've been doing it, thousands and thousands and thousands of times. So because of that, you would think that the reading that you would get after the swing would somehow be the same every time the person swings a golf club. And the funny thing about research is that what research demonstrates that it's the exact opposite. As a matter of fact, that golfer displays a variety of different ways internally to produce that external movement. And every time they swing, it's done differently, because every time you move, the variables that are working against your body or with your body, they change, right? So you do one golf swing during the test. The next time they go, okay, do it again. So they do the golf swing, and, there's a reading, your multifidus came on this time, your semimembranosus contracted while your tendinosus relaxed, blah, blah, blah. There's like a reading. You swing the golf club, so the person goes, okay, do another rep. They go back to their spot. They're probably not standing in the exact same way. They're not thinking about the exact same thing. They just gave their body a repetition whereby the body started to figure out a little bit more as to how they want this golf swing produced. And then you realize that when you do the next repetition, there's a women's volleyball game going on next door, and you can't help but give some of your attention to that volleyball game. So all of these variables create this environment, or you can call them boundary conditions, into what you now need to move in order to create this motion. And there's external boundary conditions, but there's also internal boundary conditions. Like if I can only lift my arm up this far, right? That is a boundary condition for flexion that I have to work with. So if you want me to put my arm back here, I have to find a way to change my body's function in order to compensate for my lack of shoulder flexion. That's just one example. So every time you run it, it ends up being different. It ends up that the body goes, okay, where am I? Where do you want to go? What is my internal environment doing at this particular time? Okay, try this plan and see if this works well. So you execute the plan, and as the plan goes, as you start to swing that golf club, as variables come into the body, the light, the sound, the whatever, your body makes changes as you go, right? Such that the next time and the next time it's done differently. That's, sums up a very complicated concept in dynamic systems theory. But the main point is that whenever you have an external task, your body will emerge a way to produce that task or that movement. And the way that it does is to look at its internal environment, its capacities, its position before you move, and it says, what do you want to do? And it's always different. So what does that tell you? It tells you that what told me that perhaps training has been focused on the wrong target this whole time. I don't want to say wrong target. You do have to practice patterns in that you have to practice skill, but there's a big difference between skill training and training. And what people do is they tend to smash it together as if it's the same thing, but it's not the same thing. Training is there to build the internal capacities of your biological tissues, of your joints, so that they are able to respond to and deal with as many movement variables as possible. And that's the difference between a good mover and a bad mover. I can't golf. I suck at golf. So if my ball goes into a sand trap, I only have maybe 10 shitty ways to swing a golf club, and none of those are going to help me out of that sand trap. But if you're a skilled golfer, your body has a variety of different ways to express the movement you want to get to, right? So, they can run a different way. So I suppose one of the big things is that we concentrate not on only the pattern, but on the individual biological or articular capacities that allow you to produce that pattern in a variety of different ways, because that's how it works. Like people, it's almost hard to argue with this, because that's just how it works. Over and over, the studies demonstrate this dynamic system idea as to how movements are created, and it happens differently all the time. And what is 100% true and irrefutable is that 100% of the time that movement was created by your body. Even more specifically, it was created by the workings of your internal biological assemblages, right? Which means that if there's a restriction internally, that's the first one you're going to come up across when you go to produce a movement. And you can't practice your way out of a lack of capacity, right? If you want to throw head kicks, I can't say, come on, throw it higher. Like that. It's like if you have glasses and I'm like, just take them off and concentrate, really look better. It doesn't work that way, right? You're working with what you have. And if what you have, if your tools are not working, then the end result is going to be a movement which is blind almost, right? There's blind spots and there's, the more control over you have your body, the less your movements falter. The less your movements falter, less chance of hurting yourself. It's kind of a realization more than anything. And then, because of that realization, when I said before, when you reevaluate all the literature, everything falls back into place in that you don't do anything different. You just change your focus. So it's not on the display of strength. It's on the internal ability for the body to produce the display of strength, which changes everything, right? When someone says, today is back and bis or shoulders and tries, how about ankle? When is it ankle day? Like, right. When is it support the hip day? When is it, look at the hip, find out what it can do, and then apply training to make it do what it can't do. You know what I mean? So that And then if you study it this way, a lot of other things come into understanding. If you have a hip, there's a ball in a socket. If your hip can only move one way, then every time you move, because let's say the capsule around the hip joint is tightened or the muscle, whatever it is, that means every time you move, you're going to keep moving the same way. If my joint can only go there, it can't go back, it can only go there. Every time you try to do something, guess where it goes? It goes there. And it goes there again and again and again and again. And then people end up coming to me in my therapy as a treating practitioner. They go, I hurt my this, I hurt my that. Well, yeah, because if you always move into the same spot, you're always using the same tissue. And the same tissue cannot adapt inevitably for the rest of time. So you will run into these limits of adaptation, which people call repetitive strain injuries, right?
Right. So driving from the idea of internal constraints, driving towards compensatory patterning, was it a challenge to create an assessment to figure out what point A was for people, and an assessment that anybody who's a practitioner can do, which is one of the things I love about the FRA is that, honestly, it doesn't matter what you do, you can do the FRA as an assessment.
Yes.
It doesn't necessitate you to be a hands-on practitioner to do the FRA. So I'm curious, was that a challenge as you were looking through and creating basically an internal constraints or a workspace assessment for people to be able to figure out what point A was?
I don't remember if it was a challenge. I remember during this whole journey thinking to myself, there's a lot of other characters involved. Like there was a lot of my work, but then I had, people helping me. A lot of them are still in the system today as teachers. And I remember saying, man, like someone would message me, can you believe this study just came out, which corroborated everything that you were just saying about this, this, and this. So I don't remember it being a challenge, but I do remember it that once you see it, a lot of other things become obvious. So like you said, how did this FRA, this functional range assessment, come to fruition? Well, if the idea is that when someone walks through the door, that person is, they have a list of prerequisites, the things they can do, and there's probably a list of things they can't do. And if my job as a trainer, or therapist, or a strength and is to challenge what they can do and to make available what they can't do. But where is that assessment? So now you combine that with dynamic systems theory. So now if I tell you about your shoulder and I say, well, look, your shoulder needs to do a variety of different things. And the anatomy that evolved to do those things, it was a very complicated time when people make it seem like, oh, my bicep does this, right? The reason why we think that is because cadaveric study, whereby we would thread string through the bicep and into its insertion, and then you pull on it and it does this. This is how we were thinking of things, right? But that's not how the body works. As you know, the bicep does a variety of different things. The way the muscles contract now, if you remember things like sliding filament theory from first day, first grade, and that's how you remember the way muscles work, you've missed a whole ton of literature that demonstrates that you're not only wrong, you're 100% wrong, right? The idea that muscles contract only in a particular line and that all of the forces are along that's completely not true. We now know that as a muscle contracts, it radially expands, forces go laterally in all different directions, actin and myosin spreads out as it slides past. There's a lot of different changes. But getting back to what I said before, if someone's coming in and I have to train them, I have to know what they can do. So people talk about they go to the doctor to get physicals, but there's no such thing as a physical. There's just chemicals. Like you go to your doctor, they take blood, they check your heart, they check you out, but no one's monitoring the physical capacities of the individual joints, which provide the boundary conditions for movements to emerge in or with. So FRA asked the question, well, what do you want to know as a trainer, as somebody taking care of another Homo sapien whose job is to make them better at it? What do you want to know? Well, the answers are, I want to know exactly how much passive range of motion they have in all of the different directions. And then I want to also know what is the active ability to control those ranges of motion. And with those two things, right, in addition to a CARS assessment where I can see the display of what we call the workspace, with those three things, I can tell you without even seeing the person, if you give me an FRA, I can pretty much look at the FRA of your client, and I can say, you should do the following things to amazing detail, right? This shoulder has this much passive range of motion, but it only has this much active. So there is a deficit of 40 degrees between active and passive. Well, why is that important? Well, it's important because if you swing your arm up passively, there's 40 degrees at the end range whereby your nervous system has exactly no experience controlling, which means you have 40 degrees of potential injury, right? So in FRA, we talk about how when you take a passive range of motion, you have to also know what you can actively do with that range of motion. Just because I can passively put my hand over my head, it doesn't make it a good idea to actively load my hand going over my head, right? It doesn't. But if you went to that box gym and they're doing snatches for time, guess what? You're throwing that arm over your head. I don't give a shit if when you can only get to here and then you hyperextend your back. Doesn't matter to me. I just want you to do, this Murph or whatever. I want you to do it as fast as you can. God damn it. Because that's what you want, right? You want to be functional. And then the person, that's another thing I notice is that what do your clients want? They want to be functional. They want to be strong. And you ask clients and they're like, look, man, I want to get up in the morning and not feel like I'm 130. I want to get to the floor and play with my kids. I want to be comfortable. And everyone pretends like everyone's, and I deal with pro athletes, so it changes. But when you get even to a pro athlete, if you really ask them what they want more control over themselves. Right. Because if you're working with LeBron James, the only thing that makes LeBron James better, like if I give you LeBron James to train, if I give him to 10 train, what are they going to do? I do a particular type of squat, or I'm more of a kettlebell guy. That's what's going to take LeBron and make him better. Better than what? It's LeBron, right? So the only thing that makes LeBron better is if you can make LeBron's body do exactly what LeBron's brain wants him to do. And if LeBron's brain is functioning in a dynamic system, which everyone is, then the answer to your question, what should I do with him, is to make all of the components of his body that allow him to move completely free to move in the way he wants them to move.
Right.
That was FRA, right?
Yeah.
So I can't do that. So instead of doing overhead press, maybe we'll work on your strength by doing presses here, as I also put inputs to make this better. So people also get confused into thinking that I'm just making a bunch of weak, bendable people. That's not, I work with Westside Barbell. It's the strongest people in the world. It's not about that. I'm all for powerlifting, Olympic lifting. When I train people, it's not a fun walk in the park. It's
right.
The opposite thing. So I think it might be a misconception.
No, and you know what's funny about the functional range system itself, when people ask me to describe it, I say it is the least exclusionary system you will find, because all it wants to do is give you the ability to do the things that you want to do. Like that's the whole goal. It's not telling you to take your training and only found it around how we run and throw and jump. That's the only way you can do it, and spiral lines and stuff like that. It says, hey, what is your biology telling me? What do you want to do? What do you need to be able to do? How can I give that to you? That's honestly. So if you're a baseball player, what are your requisite ranges? If you are a mom who just has to pick up your kid and your kid's only going to get bigger, what do you need for that? So that's the thing I've always loved about the system. And maybe you just said it. It's not exclusionary. It's inclusionary, which is also why you've taught it for the NBA and the MLB and NASA and UFC, because any one of them can adopt it to then make their people better at whatever sport they're playing.
Specifically, yes. Like you said, it doesn't. People say, like, why didn't you come up with like a FRC golf or a FRA for soccer is because it doesn't, the words, like, it's one of those things where if you kind of listen to stuff online, you get tidbits, you're like, whoa, this doesn't make any sense. But once you're an hour into the intro lecture at FRC, you're like, oh, wait a minute. I was judging this based on preconceived notions of what I thought, oh, everyone has a way to train and everyone, this guy figured it out. I've said this, I'm against that, right? Like the nervous system was, the human was forged over many years of a chaotic natural selection process. The idea that someone somehow understands how the nervous system works, and everyone up to this point didn't get it, but this guy, when this muscle is turned off, this muscle turns on.
Right.
Listen, I have studied, I have looked everywhere for the answer to the research to back up those kind of claims. I have never once, right, looked at neurobiological research and said, oh yeah, when that muscle turns on, that one turns off. If you really think about it, there is no such thing as your muscles. Muscles are just mouth noises that we give to groups of muscle fibers that have slightly thicker outer fascial borders, right? That's it. Every single muscle fiber in its own right is its own muscle. It has its own stress strain curve. It's dealing with things independent of everything else. So the fact that we call a glute, and we talk about how the glute is on or off, that makes, and maybe if you haven't studied it as deeply, this sounds crazy to you, but if you ask any neurobiologist in the world, can a glute shut off? The answer would be sure, if you sever the nerve going to the entire glute, the root nerve, right? Because as you know, motor units are served, they're a nerve and then a few muscle fibers that nerve serves. And if you think about the all or none principle of contraction, it refers to motor units, not to entire muscles, right?
Sure.
I don't remember why we were getting in this. Going back to it, you were talking about the inclusionary aspect of it, I believe.
Yes.
The system. Yeah. Going back to yoga. Yoga is awesome. Treat yoga as a sport, right? The display of patterns, you can call it. Treat it as a sport. Train your body to be excellent at yoga. That's what the functional range systems does. Pilates.
Yeah, exactly.
Train your body to be good. Train your body to be good at running, or train your body to be good at jumping, or whatever it is you want. And then from a therapy standpoint, again, there's a lot of different therapies where people talk about, this muscle's on, this is off. I touch here, I touch that. That's fine. You do what you want. I make decisions as to what I believe is a waste of time for my time, and you do that for your time. But we do have to agree that a shoulder was evolved to do a specific thing. Shoulder things, right?
Right.
And if your shoulder cannot do shoulder things, then we should probably care, right? And once you find out what your shoulder can't do, there's no such thing as resetting the shoulder. There's no reset. There's no it is what it is, right? So if your shoulder doesn't do that and you want it to do that, you have to train it to do that. And all we're providing is a systematic way of using real strength training, right? Real force inputs in order to create real lasting change. Let's get back to my point before. My muscle's off and now it's on. That's not how the system works, right? And I can't be like, oh, your glute's off, I'll fix that. Oh, bam, look, your glute's on. I can do that temporarily. I can. I've done that before where, people talk about leg lengths are off. I'm like, okay. And you've seen that demonstration. I think it's on YouTube somewhere where I'm like, okay, so look at this. Leg lengths are off. And then I ask the person in the front row, pick a spot on the body. And they'll say, I don't know, left earlobe. So I flick the left earlobe, go back. Oh, look, the legs are lined up. Like it's not hard to do little neurological trickeries. People are always trying to, what's the word? Find the loopholes. Biohacking, that's the word. They're trying
there you go.
Biohack the body.
Whole conferences on it.
Now, you're talking about a system made of trillions of nerves, Okay.
Yeah.
And all of those nerves are they not only have thousands of connections, but they're continually making different connections. And now if you bring in the research from people like Seth Grant, where they're looking at the synaptome architecture, now you're realizing that people thought understanding the nervous system was a matter of understanding a signal that goes from here to here, and then from here to here, and then from here to here, as if one nerve with its dendrites and another ball, and there's a synapse, and information goes, activate that nerve, and it goes. Now we know that it's not that simple. Now we know that there is actual logic at the level of the synapse, whereby one postsynaptic bulb can release a variety of combinations of different chemicals, whereby the receiving bulb is going to get a completely different message than the time that we sent before. So we're talking about levels of complexity here, which is far beyond our ability to mathematically computate these things. Like, it's far beyond. Okay, you add that to the idea that we know, you don't pick up a dumbbell and lift it once and automatically get strong, right? You have to challenge the body over time. So force input over time equals long-term change. And there is nothing that shortens that time, right? I don't care what system you're using. Good, go ahead. But at some point, you have to tell yourself, if I want my shoulder to go further than it does, I need to challenge the system in a way to force the body to make a change. And by the way, the body's job is not to adapt to your little input. The body's job is actually to conserve energy. So if you want it to change, just like if you wanted to lose that last 10 pounds and you're like, man, this is hard. Yeah, of course it is. If you want it to change, you have to force it to change over time. Right? Doesn't happen in the next time you see your chiropractor. It doesn't happen when you see your physio. They might make you feel better. They do amazing things. They do amazing things for people. But if you're not, if you go to a therapist and they're not giving you follow-up specific exercises that exactly speaks to the tissue that had the pathology in order to make a long-lasting change, you will not make a long-lasting change. Says science. Says every bit. I challenge people, find me a study that shows that a single input into biological tissue leads to long-term changes. I've taught all around the world, thousands and thousands of people. No one's brought me this research.
Yeah, and that makes I'm 100% with you on that. It brings to mind, the SAID principle that we talk about in strength and conditioning, which is, specific adaptation to imposed demands.
Yes.
And how when I explain what our next topic is, which is ISM, to somebody, they're like, well, we squat, we'll get better at those things. I was like, yeah, but the term specific in there, it's specific. If I specifically want to get better at something, why would I not want to train specifically that thing? It feels like it just feels like we're working this macro, this big, hey, if you squat, you're going to have hip extension and knee flexion and ankle dorsiflexion. Then let's load it. And then let's add velocity to it. And it's like, yeah, but what if it says specific, like my system reacts to specificity. So is that what was born out of how ISM became a thing?
That was a major thing. And I was going to say that parlays into the talk on ISM, which is the internal strength model, which there's a lot of jargon going on with their talking. I don't know who's listening, but it's not as complicated as we make it sound. Like we're nerds this way. We get deep in the weeds. Really, when you go to see someone, it's as easy as, okay, you can do these things, so we're going to program you. You can't do these things, so we're going to program you, and let's go. And if you want to lose weight, sure. If you want to gain muscle, sure. It doesn't supersede anything. It only enhances everything. But with regards to training, I think, and I believe that this was born out of this motor program concept that has been there forever. I think that people started to see exercises as the goal, as opposed to seeing exercises as the tool to obtain a goal. So when someone says, I'm squatting, so I can get better at my squat, unless you're a power lifter, getting better at a squat means that you're going to have to practice the squat. If you're a mixed martial artist, you have a lot of stuff to practice, right? You don't have an infinite amount of time to practice things. So if I see a mixed martial artist practicing Olympic lifting, there is a problem with the focus of training, right? The squat's not going to get you what you want. The squat is something that you can use. And then you have to ask yourself, what do I want out of this squat? And that alludes to what you were saying. In the ISM, we break down all of the inputs so that you can specifically choose the input that you actually want. What is the capacity you want? Very easy example. You take a distance runner, okay? You take the best distance runner in the world. I use this often, Kipchoge, I can't pronounce his name. Best distance runner in the world. And now he comes into your office and he goes, Jesse, I want to be better. Well, better than who? You're the best, right? So I want to be better than myself, conceivably. So if you take someone like that, in my mind, that person has sucked out all of the efficiency that they can out of their biology. That's why he's the best, because when he goes running, all of the tissue is working at such an efficient level that he can suck out all of the benefits of having muscular tissue, connective tissue, whatever it is. So how do I make that person better? I have to change their tools. I have to change their biology. Okay, so then people say, oh, I understand. So you want them to get stronger. But the word stronger is like the word mobility. It's not real. Like, what do you mean by stronger? Stronger how? There's a lot of ways to get stronger, right? Sure. You know, you can get very simple example. You can increase the amount of force that your red tissues can generate, which is your muscle, or you can increase the amount of force that your white tissue can absorb, which is the connective tissue that muscles live in. Both things are going to get you stronger, right? But are they going to get you stronger in the way you need to be stronger? So if you take a runner and you say, you know, doing glute exercises is good for them, you know, lateral glutes, glute min, glute med. Why? Because every time you run in a sagittal plane, every time your foot hits the ground, your body shifts out to the side to some extent. So if you have stronger muscles, you'll have less lateral shift, which means you're not losing energy laterally, which means most of your forces go sagittally, which means you become a more efficient runner. Awesome. So what do? Here's some clam exercises for your glutes. Okay, and how many clam exercises do you want me to do? I want you to do 3 sets of 10. Why? Well, nobody asked me that before. Well, because, you know, and then just 3 sets of 10. Like, or I'm going to start squatting max effort. Why? Because I want to run. I want to get stronger. Okay, but what you really want is you want more specific tissue that is that you can pull more efficiency out of for distance running. So what you're really asking for is more slow twitch muscle fiber and better quality white connective tissue, such that the slow twitch muscle fiber can pull into good quality tissue and not lose energy in that exchange. Those are the things you're asking for. In my world and in the internal strength model, that leads you down a path of extraordinarily specific types of training. Very basic. Am I going to do clam exercise? Probably not, right? That's just a generic exercise that people give you. But if I did, I can tell you that I'm not going to get the person to do 3 sets of 10. I'm probably going to get them to do continuous training sets that bring them into the 2-3 minute marks at a slow pace in order to specifically fatigue and recruit the slow twitch muscle fibers such that I force the body to give me more of those, which I can later take advantage of with my cardiovascular training. It's a huge difference, right? It's not the same thing. Would I train the intrinsic foot muscles of a distance runner the same as I would an Olympic lifter? 100% not. An Olympic lift, they literally give you a shoe that's made of in order to compensate for your bullshit foot that probably doesn't have the speed contraction ability that it needs to land that squat, right? And that's not going to be made better by putting your foot into sand and doing 5-minute sets of slow contractions. It's not. It's not the same thing. And I you know, in our profession, it's very easy to look at someone spouting off and go, "Ah, this guy doesn't know what he's talking about." But like I said, I've taught this to thousands and tens of thousands of people, researchers, people who, and when we talk in these, I've still yet to find someone who's like, "Well, yeah, that doesn't make any sense."
Right.
Most people are like, "Well, yeah, what you're doing is you're taking all of our techniques of strength training and you're saying these techniques do not provide generic results. They provide specific results. Ergo, your assessment and your programming has to be specific." Now, this also brings us into another problem that we have, which is what I refer to as the volume problem of training. The more specific you are, the less time you waste, the less energy you waste on things that are not going to give you the things you actually need. Right. So, most people, when something's not going their way, their answer is more volume. Just do it more. But if you're dealing with a professional, I think I got this from dealing with pro athletes. I don't have a lot of time, and neither do they. Like, if I'm with a jiu-jitsu athlete, time on the mat. You know what makes people better at jiu-jitsu? Jiu-jitsu. And the practice of jiu-jitsu. Now, people say, "Well, I'm going to I have to get in there and I have to do these squats because, oh my God, I have to. I don't think you do. I think that if you're efficient with your inputs, if you break it down with what you need, if you have a systematic approach to get what you want, using the scientific literature, no nonsense, stuff here, I think that you end up reducing your volume significantly. And it's my opinion, we didn't even talk about injury yet, that most of the injuries that our athletes sustain is because of our training as opposed to being a preventative from our training. I think that we take athletes whose body is already going through a lot of extra demands, and we're giving them more of the same demands. Another story, I don't know how much time we have, but I remember I was teaching for a bunch of MLB teams. We had there must have been 10 teams in the room, so all their strength and conditioning staff. And I was in Arizona somewhere. And as I started lecturing, I noticed that the team whose facility we were at, they went outside to do batting practice. Okay. So I start lecturing, half hour later, same thing. Like, they're still doing batting practice. Hour later, batting practice. Hour and a half later, batting practice. Hour and a half, then they come in to the gym. Okay. So I'm taking a break, so I'm watching them. So what do they proceed to do? They proceed to give them rotational exercises. And then I look at that, I go, "Oh my God, what the hell were you guys just doing? You guys were practicing moving a moment arm in order to strike a ball at the end of the moment arm, which produces quite a bit of force, as fast as you humanly can into rotation." So you've already trained that. And how more specific can you get than to actually hit balls, right?
Sure.
And then you come in and you start throwing these things at the wall. And then why? Well, because baseball is a lot of rotation. And that's as much as people get for that. That's why we do it. I would argue, and I do, that the spine, the basic premise of the spine is flexion extension. Right? You're built with a primary curve of flexion. Extension is then learned, and then lateral bending and rotation is a combination of different movements, including flexion and extension. So when I get a pro baseball player, oftentimes I check their segmental ability for their spine to flex and extend, and I don't see it. And in and around the area where they can't flex and extend, that's where they have that chronic rib sprain from hitting balls at the batting cage for 4 hours. So what should be done? No more rotation. You need to fix that person's deficit such that when they swing their bat, they're not funneling the energy into the exact same tissue that they're compensating with, which is why it gets injured. Now you have a body that can segment and move. Now the dynamic system allows you to find different areas of tissue with which to stress to produce the same external goal. Volume comes down, right?
Yeah. Which is necessary because we, especially for the athletic community, you're getting athletes that as they're getting into the collegiate world and if they make it that far and into the pro world, the amount of volume that they've had in their life leading up to that time it matters. It counts. Like it's so funny to me that we count training age to be able to program exercise, but we don't look at volume for how much volume that we should be putting on human beings. It's the funniest. It doesn't make sense to me as a strength and conditioning coach. But you were mentioning injury, and I think this is, an interesting segue to the last segment, which is on injury. We've talked about this before. You can't. Injury prevention is not a thing. I've taught on this multiple times. You can't prevent injury. If we take a baseball player, and this was your analogy, and I loved it. You ask human biology to throw a ball 90 miles an hour. Cool, once. Have them throw it 100 times into the same place over and over and over again. Something's eventually going to give. Like it's just that it is what it is, and our job should be to try and give people as much capacity as possible, so that these injuries aren't as catastrophic or cascading as they potentially can be. Maybe you can talk to that a little bit, and that I love the formula, that you've mentioned. I love that formula, because I explained to people, they're like, oh, yeah, I guess that makes sense.
Yeah.
Right.
Yeah, you're right. That baseball example does bring out a good point. If you think about sport in general, sport doesn't make any sense from an evolutionary perspective, right? It's not normal to do. So from an evolutionary standpoint, at no point did it make sense to pick up a rock and then use it as a projectile to kill an animal that you want to eat, right? So you take that rock, you throw it, and you kill the animal. At no point did it make sense to run to the animal, pick the rock back up, run 60 feet back, and then start throwing it again with different curves and different ball positions and different things, and put a catcher behind. That didn't make any sense, right?
Right.
So when you go to baseball now, and I remember the first MLB team that I worked with, one of the questions was, how do we prevent these elbows injuries in pitchers? And I said, before I really give you the answer, I'm going to really give you the answer. The answer is stop pitching. It's not a normal thing to do. Now, of course, you can't stop pitching. I was being facetious, but the idea is that if you're going to ask this tissue to withstand the amount of stress that happens with pitching thousands of times since they're 8 years old,
right,
there better be some specific training that is dedicated to increasing the capacity of this tissue specifically, such that it can increase the amount of force that it can absorb. Or you're not doing anything to prevent injury. Well, but you know what? We do cross crawl patterns, and, he squats with his arms over his head. He does that well. We've done Olympic lifting. He's powerful. All that's awesome. Your elbow doesn't give a shit. Your elbow, like the rest of your body, runs injury through a very simple mathematical formula, which you were talking about. It's very easy, right? I'm going to summarize years of research, right? Pedagogy and people doing studies. And I'm going to summarize all of this into a very easy mathematical equation. When you get injured, it's because the forces going into the tissue exceed the force absorption capacity of the tissue. That's it, right? That's it. So when you put force into this elbow tissue, this tissue can sustain a certain amount of force. If you exceed that amount of force that it can absorb, the tissue will yield under the force, says math and physics. Okay. So how do you prevent injury? Well, let's start with how do you treat rehabilitate injury. So let's say that your force absorption capacity was here. You came in here and you injured yourself. Now your force absorption capacity is down here. So how do you rehabilitate this? Well, conceivably, you're going to now select forces that are somewhere here, that are kind of close to what it can handle now, but not so far that you re-injure. And you're going to start bumping it up over time. If you go a little too fast, you bump it back down. But eventually you're going to bring it back up. And you're going to bring it back up to the amount of force that it could absorb before. Your rehabilitation is done in most people's eyes, okay? Which makes no sense. Because if now you want to prevent injury, and we'll get back to that word prevention, but let's just use it. It's not a matter of bringing the person back to the amount of force they can absorb and then putting them back into the environment that hurt them to begin with, which is what most people do, right?
Mm-hmm.
It's like if you ask someone, what's your last injury? They say it's, this shoulder injury. And what was the one before that? They're going to say it was the same one, right? People, they just continuously bring along these injuries, right? Because it hurts. So and then you get it better, right back to where it was before. You do the exact same thing, it hurts. Make it better, exact same thing, it hurts. And then you start to get older, and then you realize that when you hurt it again, it goes even lower than it did before, right? There's a lot of different things. So rehabilitation doesn't end when your load absorption capacity goes back to where it was. In order to prevent further injury, you have to continuously bump up load absorption capacity such that when the athlete or the person experiences normal basketball type loading, that loading's down here, whereas their ability to absorb is up here. Now you have an injury buffer. You see what I'm saying? But yeah, look at the NBA right now. There's people are taking games off because they want to load manage, right? They want to decrease the amount of load on the athlete by not letting them play the sport. But why aren't you doing that on the back end by decreasing the load of their training on tissues that don't require it? Of course, you're exceeding their load parameters. Training seems to be when the person gets good at absorbing loads, make it more, push them harder, right? In a generic way. And then, you got to miss a game. But that's your job, is to play the game. You understand what I'm saying? But I went to one more quick story. I was going to say, it's a matter of knowing what you need too, because I was doing the NBA Combine last year, and one question I asked, I was like, well, look, how strong does your point guard need to be? Like, that's another thing with training is like, I squat. Well, why? I got to get stronger. Well, how strong do you need to be? And the person goes, I don't know, just get stronger, right? And it was weird because I asked the room, I go, well, how much do you need your point guards to squat? Like, if that's what you're doing for a max effort, lower body exercise in order to drive nervous system excitability or whatever, when's enough? And nobody knew the answer. And that's a problem, because if you don't know when enough is, you don't know when to stop training. And then the volume problem gets crazy. If your sport is a specific strength sport, you're a power lifter, your job is to push the envelope of strength, then there is no upper limit of strength that you need. But if you give me a 165-pound jiu-jitsu player, if they're squatting, I don't know, just arbitrarily, like if they can move their own body weight plus the body weight of someone else, right? So, somewhere around 2 times their body weight in power, that's enough. Like, you know what I mean? Like any other time spent training strength, it might make you better here and there, but that would have been way better learning a better, sweep or a better hip escape or a better submission from north-south, right? There's time is a really valuable asset when you're an athlete, right? And you have to manage that time. And I just don't think that people give enough credence to the idea that maybe we're creating these injuries. Maybe we're the volume problem. We being the people who train other people. And again, this doesn't mean that people are, I want to train hard. These people, trust me, train with one of our people, one of our ISM certified people. You will beg for what you were doing before, right? Our warm up is your workout. Oh my God, it's worse than that. It's
right. Oh yeah.
Yes, because I need to get it done. I need to compress everything into a small amount of time, and I need to be specific so as not to overexceed capacities, and I have to manage capacities. It sounds like a lot. If you have a systematic approach, it's not as much as you think. If you're just shooting into the wind or pissing into the wind, there's a lot of stuff that we're not thinking about when we're programming for another human being.
So we have Kinstretch, we have FRA, we have FRC, we have FR, and we have ISM. Are we going to dig into the aerobic world here soon with adaptations in regards to the heart? Is that next on the list?
I don't want to. Well, we have a few different seminar.
Giving everybody a peek under the hood.
Yeah, we have a few that we're simultaneously working on. One is going to be the conditioning aspect of that. It's funny. It's the exact same problem whereby people don't consider the heart to be an independent tissue in and of itself that requires certain qualities or capacities, right?
Mm.
In order to do this, you need this much bicep. But when you're doing, anything cardiovascular wise, it's just cardiovascular. I just do my cardio, right? What? No, it's not. It's not right. It's not this. It's not that easy. Or people will make the argument, you don't need to do any long distance level 2 zone 2 training. You just have to do interval training, and that takes care of everything because they're looking at caloric expenditure, or they're looking at the ability to do feats of endurance type strength. But again, don't get confused with the feat of strength. That's not your goal. Your goal is to use training to change a capacity in the body. And as you know, when you train the heart in fast interval type training, the capacity, the way that the physiology will change is not the same as if you go on long distance runs or long distance anything. If you're doing low intensity, high duration, you're going to increase eccentric cardiac hypertrophy, which means that your where your blood pools in your heart, the cavities will get larger in order to accept more blood, in order to increase the efficiency of oxygen transfer. But if you're doing that with your heart, you're doing high intensity intervals, you're going to get concentric cardiac hypertrophy, where the cavity doesn't get bigger, the wall gets thicker in the heart.
Yeah.
And those are
right.
And what are you training your heart for? Like, you have to ask yourself, what am I trying to do? If you have someone who's, 50-year-old construction worker, smoker, maybe overweight, high cholesterol, maybe they had a I don't know. To me, if I showed you their heart, no one's going to look at that heart and go, what we need to do with that heart? We need to put it through high intensity exercises as fast as you can. Like, that's like saying your shoulder is fucked up, right? You have shoulder issues, you've dislocated it, you have connective tissue scarring. I know what to do. We need to do high intensity shoulder exercise. No, you wouldn't do that. It doesn't make any sense, right? And again, that's because in endurance and conditioning, it's just generically, the same reason why I argue with, when I work at the UFC, I've talked to a lot of trainers for fighters about this, about how you have to hit the pavement, you have to jog, you have to skip. No, you don't. You don't have to jog and you don't have to skip, right? When I spar for several hours, I'm pretty much jogging and skipping for several hours, right? That's a lot of volume in jogging and skipping. Now, instead of saying, okay, so now I'm going to do my cardio and I'm going to do the exact same thing. Well, you could, do more rounds. But when you're outside, you can do anything in order to train your heart. You can just clap your arms over your head and tap your feet. It doesn't matter to your heart, because your heart is a trainable thing. So you can unload stuff in order to give it breaks, or to allow it break. So again, the answer is yes. There's a different way of looking at endurance and cardiovascular training that the ISM, or not the ISM, that we're going to cover in an upcoming seminar.
I think that's really important. And one of the things I've talked about in the past is, I'm big on nomenclature, though we've kind of talked the system nomenclature a little bit, but just basic nomenclature, hey, I want to do more cardio. And my response to that is, what do you mean by that? Like, it's a bad day the day you stop doing cardio. Like, what are you trying to accomplish? Are we trying to increase your aerobic intensity or your capacity to do things aerobically? Are we trying to increase anaerobic endurance? Like, those aren't the same things. Your body doesn't respond to them the same things. You're not going to build mitochondrial density unless you're actually making O2 be the primary source of energy within the body. So it's concepts like that where everybody would say it's semantics. I'm like, no, it's important. It's
yeah.
important to be able to tell me, like, somebody just improving cardio to me doesn't make any sense. So
it's semantics it's semantics to people. 1 second. Okay. Yeah. It's semantics to people who don't have our job. Now, I want to say this because you go online and a lot of people look at and they're like, this guy is way too fucking serious about these things, right? It's way too detailed. But you have to remember that is my job, because I speak to you and then you speak to the masses. And I've started to speak to the masses, but at the level of the trainer, just like at the level of a physicist, there's a reason why specialists are specialists. And this is one of those things, right?
Right.
We have to parse these things out at a cellular level in order to really understand what we're doing. And it just so happens that if you understand the cellular level, you can scale that up to the body, and training just makes a lot more sense. Like I was saying, we're being specific, but for people out there like, this is too advanced for you. It's not too advanced for you. The system can be taken at a very specific level, as some of our medical practitioners might take it to for the diagnosis of illnesses and how to train them and blah, blah. Or it can just be this change in perception that allows you to program for yourself in a way that's not self-deprecating and injury prone, in a way that actually enhances the way you feel and enhances the way your body functions. So I hope that we're not too exclusionary in our specific talks, but that's what you and I do. You know what I mean?
Yeah, that's what we do. And I like to say that I stand on the shoulders of giants when it comes to the information I put out there. I'm just funneling it. And though you wouldn't notice by our statures when we stand next to each other, I consider you a giant in my life. So
I'm just small because you're big. Let's not get that confused.
Yeah. Dr. Spina, thank you so much for being on Living.Fit Show. I really appreciate it. They can check you out, podcast and courses and anything you want to tell the masses about that you're doing.
I have a podcast, Control Yourself podcast, that you can find on any podcatcher. All of the courses they live at functionalanatomyseminars.com or functionalrangesystems.com. And you can learn about them. It's pretty much taking a complete approach, systematic approach to assessment, treatment, rehabilitation, strength training, body practice, kind of all under the same blanket, using all the same literature. But yeah, you can go there and check that out if you want to learn more.
All right. Well, Dr. Spina, thank you so much. Appreciate you having me on the show today.
Thank you very much.